All right, so thank you for the global tallies of the past 24 hours. Up next, we bring you more coverage of the local Omicron situation. And for that, I have Choi Min-jung here in the studio. Min-jung, welcome back.
Thank you for having me, Sunny.
Right, so authorities are bracing, Min-jung, for a further jump in our daily tally, I hear.
Right, Sunny. The country has been seeing record high daily tallies over the past few days. And for 5 weeks now, Korea's COVID-19 alert level has remained at high. Authorities revealed that 98.9% of infections confirmed last week were the Omicron strain. And in Jeju Island, the variant accounted for 100% of the new patients last week. Health authorities released a forecast on Monday based on studies conducted by 10 domestic and foreign institutes that the Omicron wave will hit its peak in late February or early March. And they expect daily cases to reach anywhere between 140,000 to 270,000 at the high water mark.
Right, and Min-jung, regardless of those alarming numbers, I hear authorities are urging against public panic.
Yes, they are cautiously optimistic that the current situation may be the start of a transition to an endemic phase of the pandemic. We've been seeing around 100,000 daily cases in the past couple of days, but the government says that there's no need to be overly concerned. Authorities revealed on Monday that the fatality rate of Omicron is around 0.13%, which is a manageable figure. Although it's twice as lethal as the seasonal flu, it's also a much lower figure than 0.7% death rate for the Delta variant. However, authorities also stressed that Omicron's fatality rate could be even lower than the seasonal flu among those who've gotten their booster shots. And data also shows that no one under the age of 50 in Korea has died so far from an Omicron infection. As of now, many experts are saying COVID-19 will likely become endemic, but they're still very hesitant to project a timeline on when exactly this will happen. KDCA Chief Chung Eun-kyung hinted that this outcome is possible if enough immunity is formed in the population and our healthcare system remains stable without the introduction of a new deadly variant.
Right, I see. Meanwhile, on the vaccination front, Min-jung, what's the latest with regard to Novavax here in the country?
Well, Sunny, the number of people getting their first shots rose by nearly 20,000 on week after Novavax's vaccine started rolling out on February 14th. More than 43,000 people got their first shots last week, which is up around 19,000 from the week before. And around 63% of them received the Novavax vaccine. The vaccine is being met with less worries over possible side effects as it was developed using a more conventional method without the use of genetic materials. Meanwhile, there was also encouraging news regarding the effectiveness of Pfizer's oral drug. In a survey conducted on around 300 Paxlovid recipients here in Korea, 81% of the respondents said the drug was effective in treating respiratory symptoms and sore throats. And the majority also said that their conditions improved within 3 days of starting the drug treatment. And data also show that none of the people who took the complete 5-day course of the drug became severely ill or died.
Right, well, that is encouraging to know. And ahead of the new academic year slated for March, Min-jung, I understand virtual learning is back on the table.
Right. Education authorities said Monday that schools can freely implement online classes or adjust school hours during the first 2 weeks of the spring semester. This means if the virus situation worsens, all classes can make a switch to full remote learning. Initially, the Education Ministry decided to hold in-person classes in the upcoming semester despite the current surge, and schools were advised to switch to online classes if 3% of all students at a school were infected or 15% of all students in a single grade were absent due to infection or self-isolation. But now this new guideline has been scrapped for the first 2 weeks due to increasing number of students coming down with the virus.
All right, Min-jung, thank you for now, but do stay behind for more talks.